Welcome to Innovators, a series where we sit down with thought leaders in the healthcare technology space to talk about trends impacting the healthcare industry today. My name is Justine Giancola. I'm on the corporate communications team here at Inovalon, and joining me today is Pooja Ika, founder and CEO of eternalHealth. If you're not familiar with eternalHealth, they are a female-owned Medicare Advantage health plan, and their mission is to make high-quality, affordable care accessible to everyone. So thank you for being here today with us, Pooja.
Thank you for having me, Justine. I'm excited to chat with you.
Great. Well, let's get into it. So you graduated from Babson College, which is well known for its focus on fostering entrepreneurship. So tell us a little bit about, when did you commit to being an entrepreneur, and kind of walk us through those early days of taking eternalHealth from just an idea all the way to your first members.
Yeah, so it's crazy to think that that was now almost 3.5 years ago. But for me, as I was kind of going through Babson, I knew I wanted to stay in healthcare. My mother's a primary care physician, and my father is an entrepreneur on the technology side of healthcare, and I've been surrounded by healthcare for as long as I could remember. And I really was passionate about providing care to people. So for a very long time, I thought I was going to follow in my mother's footsteps and be a doctor of some sort. I had so much respect for the physician community. And I think as I started to think through what my specific skill set was, I realized that I was really good on my feet. I was a really good problem solver. And I had a sense of business acumen that I think would have been really valuable in the insurance industry. So I dabbled a little bit in the exchange space, and I looked to see really where I think we could make the most impact. And that's how I stumbled across Medicare Advantage. And I think that as I look back on our journey, one of the stories I always share and tell is my dad very early on had said, just go print out the application and start working on it. And this was the application to the Division of Insurance. And I still remember that to this day because they were asked for org charts and so much information. And it was just myself at that time. So I was like, okay, what do I do? Do I put myself in as all of these roles? So it's been such an interesting journey. And now I'm so proud to say that we have a team of about 35 people. We're in both Massachusetts and Arizona, and it would have never been anything I could have ever envisioned or expected. And there's been so many twists and turns along the way, but I've been really fortunate to be able to go through all of those with such a great team. And I am really grateful to have the opportunity to serve our members in both Massachusetts and Arizona and really give back to the community that's given so much to me.
That's awesome. And I think, what makes that story so cool to me is that, you grew up seeing healthcare from maybe a different lens than a lot of us do. So you have some background and history that you can really pour into what you're doing. So that's awesome. Now, we know that there are lots of plans to choose from. So tell me, what would you say makes eternalHealth different from other plans?
So I actually think it's something that you just described in our mission when you were introducing eternalHealth. It's all about making sure that we're providing access to care and benefits. So one of the most important things that we're focused on is there's so many plans, like you said, and people oftentimes pick a plan for a reason, but then they completely forget about that specific benefit. And so one example I'll give you is a lot of plans offer transportation benefits. But very rarely does a member actually utilize it because they don't know how to. And the actual process of getting access to the benefit is so complicated. And so for us, it was really important for us to create benefit designs that focused on the needs of the beneficiaries that we were serving. But beyond that, that actually accessing those benefits was easy. We were being as transparent as possible, and we were really empowering our members and tapping into ways that were viewed and perceived as easy for them, right? So for example, with transportation, we do offer Uber and Lyft transportation, so on-demand services, but they're able to do it by getting on the phone instead of having to use an app. So giving them that flexibility and freedom to get access to the benefits in the best way possible for them was really important to us. And then beyond that, I think we've all been on the receiving side of customer service, and I always tell our team, when anyone's calling into the customer service department, they're not calling in because they're super ecstatic and happy to be calling in, as I'm sure all of us feel that same way too when we're calling in. So it's really important for us to put ourselves in the shoes of our members and do everything possible to make sure that we're going above and beyond and really providing them white glove customer service.
That's awesome. And I think this is kind of a follow-up to that is now you're shopping for a plan. These are all great benefits that differentiate you from others. But how do I know if Eternal is the right choice for me?
Yeah, so typically, right, people obviously look at the products, but then they also look at the network, and then they will take a look at the supplemental benefits. I would say that we have worked really hard. We have 4 products in Massachusetts, 2 HMO products, 2 PPO products, and then we have 3 products in Arizona. And we've really tried to curate them to meet the needs of the market. So, for example, with our PPO products in Massachusetts, we have built in $0, actually across the board for all of our products, both Massachusetts and Arizona, we've built in $0 PCP copays, $0 specialist copays. For our PPO products, we have really low out-of-network copays for specialists, and we've kept our PCP copays at $0. Again, focusing on access to care and really removing any barriers that you could foresee. I think people oftentimes have the misconception that Medicare Advantage products are only for those who are, on the lower income or medium income side, but that's really not the case. In Massachusetts, so many people go to the Med Sup side and they don't realize how much money they're just leaving on the table. And so for us, we really want to be going in and educating the population and helping people understand that one of our 4 products in Massachusetts or one of our 3 products in Arizona really can meet the needs for most people.
That's great. And I know that, I mean, even as a shopper for health insurance, it's a lot of times hard to know what really are the benefits, what should I be looking for. So it sounds like you guys do a great job of kind of outlining what those differentiators are. So that's great. Looking at eternalHealth's board, including you've got executive leaders from brands like Apple, Johns Hopkins. I mean, those are some pretty impressive names. So what would you say the biggest benefits that you've realized personally and even from kind of a business standpoint, benefits from their involvement and support?
So I think for me, it was really important to bring together a board that was very diverse, and also a board that was kind of coming from different backgrounds. So I wanted people who came from large national carriers, as well as people who came from the startups that, have been kind of new in the space, but really rapidly growing. And the idea there was to really learn a lot of lessons in regards to the do's and the don'ts. And I've been so fortunate to be able to do exactly that. And in addition to that, John Scully, who's the former CEO of Apple, is actually the chairman of our board. And John is such a visionary as it comes to marketing. And so for us to be able to tap into his knowledge and get insight from him is something that I find to really be invaluable.
For sure. And as someone who works in marketing, I can imagine that that is quite the benefit. So that's very cool. And, Apple, of course, being a tech company and seeing how healthcare is evolving, we're seeing it daily. Being tech first is really the norm in this space. So what does tech first mean to eternalHealth?
So To Eternal Health, being tech first means that we are embracing technology, but we're not reinventing the wheel where it doesn't need to be reinvented. And so, what I mean by that is for us, we leverage a cloud-based platform that embraces robotic process automation, machine learning, and artificial intelligence. And the technology really sits on our back end. So what it does is when you think about a health plan, there's 15 to 20 really siloed departments typically within a health plan. And all 15 to 20 of those departments leverage anywhere between 20 to 30 different technology vendors to be able to do their day-to-day operations at large corporations. And with our platform, we're actually able to reduce the need for a lot of those vendors, if not all, and we're able to replace it with this one kind of end-to-end cloud-based platform that sits across all of our departments. And so with that, we are not only able to see a significant reduction in the cost that's associated with actually working with all of those different vendors, but we're also able to see a reduced room for error, and we're also able to automate close to 2,000 to 3,000 functions. So all of that essentially means that we're able to reduce our admin costs significantly and take some of those savings and actually allocate them towards areas that really matter, like our members, our provider partners, our brokers, so that we really can create a better ecosystem and landscape for the different stakeholders that we work with.
And I think that speaks truly backs up your mission of, we're trying to make this end user the end person here who is receiving this care and who is looking for these plans and giving them, taking that savings and putting it back into the community. So it's not just a mission that's written on paper. It's something that you guys are actively working towards. So that's very impressive.
Definitely. And I think to your point, it's also super important for us to not push technology onto our members, like I was saying before, but to embrace it on the back end to drive efficiencies wherever we can.
Absolutely. So pivoting a little bit, we are in the month of March and it is Women's History Month. And I just really want to touch on the fact that you have accomplished quite a lot as a young woman, being a CEO and all. So I would love to know who was your biggest inspiration or maybe a female mentor that helped you get to where you are now?
I would say my biggest inspiration has and always will be my mother. My mother is a primary care physician at UMass, and she was able to balance work, being a mother, taking care of my grandparents, being the one individual that ended up also just taking care of my dad's entire side of the family. And she juggled so many balls while always being there for me as I was growing up as a kid. And to me, as I think about my future and what I want out of my life, I really would say that if I could even emulate half of what she does, I'd be doing a lot. So I learn, my kind of tenacity or my resilience from her. And she's always had a lot of grit. And she came to this country with very little and was able to make a really great life for herself and support herself. Along with my father, of course, but I do give my mother probably a little bit more credit. And I credit her for my love and passion for healthcare too.
That's awesome. I, as someone who's very close to my mom, can certainly appreciate that answer. That's great. And it kind of in that same vein, as a young female CEO, what are the biggest lessons that you have learned on this journey?
I think one of the things I will again tie back to my mother, she would always tell me that, when I started out in the space and I faced any headwinds, that respect is not given, it's earned. And so I've really lived by that. Any room I walk into, I know that respect or like the courtesy of being listened to isn't just going to be handed or given over to me, but that I have to be able to prove that I deserve a seat at the table. Now, whether that's appropriate or not, it's a different story, but it is the reality of the world that we live in to a certain degree. And so being able to go into any room and really voice your opinion and feel confident in what you're bringing to the table, I think has been my biggest lesson. And the other part of it too is finding ways to surround yourself with people who truly support you, support the mission and the vision, and really are able to kind of put their ego or whatever at the door, right? And that comes to me too. Like everyone has to be able to do that for it to truly work. And the reason I bring that up is because I believe that at this point in time, and it's taken a lot of iterations, but at this point in time, I have a team that is truly able to embody that in the sense that we all have different perspectives and different thoughts that we bring to the table, but we bring everything to the table with so much respect for one another that we're able to really come to like a unified conclusion. While we might not all be aligned on the decision, we are aligned on the fact that we are one team working towards one goal. So I think that's really, really important too.
And I think that this kind of, you may have kind of answered this question, but just giving you the opportunity, any other advice? I mean, we have, our audience is broad watching this, but there are so many young women today who I know would aspire to your level of success. Any other advice that you would share or tidbits that could help them?
Yeah, I guess two things. One is I have a little cousin, her name is Priyanka, and I, growing up, didn't have a lot of people in media that looked like me, that I could look up to and say, wow, I could do the same thing. So the fight that you fight behind the scenes is most likely going to inspire somebody else. And so I always say to keep pushing forward, and nothing's impossible. It's just probably not possible the way you're thinking about it. But if you change your mindset, then it will be possible. And the second thing I would say too is that for me, it's always been really important to share your opinions, share your thoughts, and never be afraid of what other people would say or think about your opinions and thoughts. And so just to always be as open and honest and really follow through and listen to your heart. I guess those would be my two things.
I have a mentor who has, that's one of her biggest things is own it. And kind of to hear you echo that is very cool. Before we wrap up, I will kind of bring it back to Eternal Health and on the tech side. You know, you've done a lot already this year and over the past couple of years. So curious, what are you most excited for the rest of 2024? And then would love some teasers on what is to come next year.
So for the rest of 2024, I'm really excited because most of the times everyone talks about change in the landscape and the fear of change. But for a smaller, newer organization like us that's really focused on being agile, I love change. I love the fact that the market and the landscape is going to be unpredictable next year because that allows us to have a little bit of a more competitive edge. So I'm really looking forward to seeing what CMS does from a regulatory front, what other health plans do, and also working with my team to really strategize and structure our plan. And then as we look into 2025, I think you can definitely see us expanding within our two states, but we definitely want to expand. And my biggest focus is really going to be strengthening and ramping up our provider network, and really doing as much as we possibly can to find the right provider partners and grow our network for our members. And then beyond that, I think with so many changes happening on the risk adjustment front and the stars front, our goal is to continue to find partners like Inovalon to work with to really kind of strengthen our operational foundation and our backbone. But yeah, we're really excited for what's to come. And I think from a benefits position, our whole goal is to be able to ensure we're creating sustainable benefits. So you can definitely look to see that in 2025 too.
Okay, well, that is awesome. Pooja, it has been wonderful talking with you today. I kind of wish I had more questions for you so we could keep the conversation going. But as our partnership with eternalHealth evolves, I'm sure we'll have far more to talk about. So I certainly look forward to speaking with you again. Thank you so much for being with us today. And to everybody viewing today, thank you so much for tuning in. And stay tuned for our next Innovator session.
Thank
Thanks,
you so
Pooja.
much.